Hi, my name is Naima Barakzai and I'm your nurse for today. Can you please verify your name and date of birth for me?
Okay, Kim Campbell.
And the babies?
This is Zebby Boy.
Okay, so I'm going to give you some discharge teaching, and if you have any questions or you do not understand anything, please stop me and I'll answer all your questions. Okay, so the first problem is the bleeding problem. So you should know that the bleeding is going to last for 6 weeks, as long as, with a little soreness, as long as it's like getting less, the bleeding color is changing from red to brown to white, it is fine. You might have clots. Large clots are not good sign. If you have smaller clots, they're going smaller. Okay, fine. The bleeding is going to be heavy and then it will decrease over the time. You should know that when you're breastfeeding, after breastfeeding, you might experience more bleeding, and that's normal. And the color of the discharge will gradually change. You should monitor for the silent symptoms of hemorrhage, that is low blood pressure if you're soaking one pad in less than 1 hour, nausea, vomiting, pale skin, blurry vision, or any sign and symptoms of stroke, that is vision change. You should report the provider. Infection risk is high. We know that you should avoid nothing in the vagina for 6 weeks. You should avoid hot baths, pools, no tampons, no menstrual cups, no sex, no douching. That's for the infection control. Then comes pericare. So we have given you a water bottle. It's like a peri bottle. You can put the warm water in it. Every time you go to the bathroom, you wash it with the warm water. It will soothe you as well, and it will help you to avoid infections as well. Hand wash is very important. Every time you use the bathroom, wipe from front to back. Replace the pad with Tux pad in it. It will give you soothing and comfort. Apply witch hazel compresses, numbing spray for comfort. Avoid lifting anything that is heavier than the baby.
Okay.
Yeah, and limit your stair climbing as well. Rest. If you feel tired, call family member, friends, tell them to help you and help the baby as well. You can take sit spas. That's like shallow water. You can sit in warm shallow water. It's soothing. It's good for like the swelling as well. You are on a total pelvic rest, but you can do Kegel exercises. These Kegel exercises will strengthen the pelvic floor muscles, and it will relieve some perineal discomfort as well. Breastfeed. You're feeding the baby?
Yes.
That's great. You know, best milk is breast milk. But you have to, because you're a first-time mom, you should assess for cracks and bleeding and excessive pain. If engorged, please put some warm compresses on it and put some linen and cream on nipples in case if they are cracked and they are hurting. C-section care, you know the incision, keep the incision dry and clean. And don't scrub or don't pick on it, and wash it with gentle soap and water. The peri-strips are supposed to fall off by itself, on its own. Try to ambulate more. Stay hydrated. Take your medication. Because you have incision, please hold the baby in a football position while feeding, or in a laid back position so it does not put pressure on the incision. Episiostomy care, it's the same care as the perineal care. The warm sets bath, Tux pad, and give some time for it to heal. It takes time. Again, signs and symptoms of infection on the incision site will be your sudden pain. If you feel like fever 100.4 above, large clots, bright red bleeding, vaginal swelling, or anything unusual, you should report. Any pain that does not go away with Tylenol and ibuprofen, or you're not peeing for another 24 hours, that is a sign and symptom to call the provider. Medications. So you know pain is there,
Yeah.
and you know the medication doctor gave you, and the multivitamins.
Prescription. Mhm.
Yeah, the multivitamin. Are you taking your prenatal vitamins as well?
Yes.
And how about folic acid? You taking folic acid? You have to take
Using
folic.
constipation.
So you can take, if you're having constipation, you can say take Coles. It's 100 mg, and you can take it twice a day.
Okay.
It will help you to relieve constipation. And for the pain, you can take ibuprofen. At 800 mg, you can take like every hour. Folic acid is good because you're breastfeeding. You need more nutrients, prenatal vitamins, activity, and recovery. So, no sex for 6 weeks, no exercise, no lifting anything heavier than the baby, no tampons, no douching, complete 6-week rest, no climbing stairs. We talk about it. No driving for 2 weeks, and you have a 6-week follow-up checkup with the
Right, no
doctor.
driving.
Yeah, no driving. Great. If you have any sign and symptoms of postpartum depression, which is like called as baby blues, it's like a feeling. It happens to people if after delivery, because your hormones change, your lifestyle changes. There's a new person in the life. There's lack of sleep because you're feeding your baby. So please look for some signs and symptoms that are like more important, and you have to report them. It's any kind of depression should be like better in few weeks, but anything that lasts longer than 2 to 3 weeks, you have to look for signs and symptoms. Sign and system like symptoms like your difficulty concentrating, exhaustion, excessive worrying, insomnia,
Not
you cannot
wanting to
sleep.
eat.
No eating, yes, intrusive thoughts, persistent crying and sadness, and most importantly, if you have any fear that you're gonna harm yourself or you're gonna harm the baby, please call 911.
Yeah.
That's an emergency. And if you're
Do
having
many
any,
women get like that?
yeah, many women. I mean, people think that it's not, but it does vary a lot. So that's very important for your health. So do call 911, or anybody, call friends and family, and
Okay.
anyone. You should talk about it. Okay, so that was about you. Now we're going to talk about the baby. Okay, so
Okay.
baby Zed. So baby Zed had, first of all, you see the umbilical cord.
Mm-hmm.
Umbilical cord should be dry. It should be uncovered until the stump falls in. Then you cannot give him a bath. Yes, it will take like 10 to 14 days. So dress the baby in loose clothing, fold the diaper down so it does not stick to the diaper and hurt him. Make sure the diaper does not rub against it. Please do not pick on the cord, and that's mainly more important. It's a baby boy, so we have circumcised him. So we have to look for the signs and symptoms of infection. Pus, red discharge, foul smelling, swelling, or if he is not urinating in like for 12 hours after circumcision, or there is no healing going on. So you need to call the pediatrician about it.
Okay.
Keep the area clean and dry. Apply some Vaseline because on the tip, because it's gonna help not to stick with the diaper, and
Okay.
it's gonna be uncomfortable. Great. So we are gonna check for the output, urine output as well. Usually baby is like, if a baby is 1 day old, it's soaking 1 diaper, but at 2 days, 2 diapers, 3 days, 3 diapers. So it can go up to 5 to 15 diapers, like pee diapers I'm talking about.
Okay.
Poop diapers are usually with the times like baby, they start breastfeeding, and the more they breastfeed, the more they pass the stool, the more they
Okay.
poop. So there should be like, by the age of like 5 to 7, he should be having like 3 to 4 poopy diapers.
Okay.
Please, if the baby has like a rash due to the wet diaper, use a barrier cream. Okay, you have to look for the silent symptoms for like less than 2 stools a day by the day 3. If the urine is dark, yellow in color, white or bloody stool, or any reddish stain in diapers for like first 72 hours. You need to monitor that. Feeding. So the baby is breastfeeding. That's great. You have to feed the baby like 8 to 12 times in 24 hours.
Every 2 hours.
Yeah, I know it's hard, but even if he's sleeping, you have to wake him up every 2 to 3 hours and offer him feeding. Offer both breasts, like because the mature milk is on the backside. So yeah, so it will take time. So you have to make sure that you offer him first breast, burp him, pat him with the bag, and then offer the second breast as well. Feeding can be like I told you 2 to 3 hours breastfeeding, but if you transit to bottle feeding, then it should be 3 to 4 hours instead of 2 to 3 hours. So the main focus is about like the baby should regain his weight, birth weight, within 10 to 14 days of feeding. And cluster feeding on demand is fine. Bathing, skincare, baby can be submerged in water for bath, like the body in the bath.
After the cord falls
After the cord falls off. Because very smart, you know it.
Yes, every week. I have a bath when it comes off.
So water temperature should be 100 Fahrenheit, not very cold, not very hot. As soon as you finish bath, dry him up and put the clothes on, because baby can get hypothermia. Their body surface is bigger and their mass is less. So they get hypothermia and it's very difficult. Thermoregulation, normal range, you should know that the temperature is 97.7 to 98.6. Should be in between. Less than that temperature is alarming. Baby is having cold. Or why is it? Don't frequently change the clothes just to take pictures, you know. I know, but you have to look for the baby as well. Yeah. House temperature should be like 68 to like 75-ish. If baby has a low temperature, provide skin to skin. Yeah, this is the best. Hat, warm blanket. Dress them into like according to the seasons, and look for the signs and symptoms of overheating, which is we actually overlook that. Assess the temperature. Anything above 99 Fahrenheit or greater should be reported. There should be 2 thermometers, axillary and rectal. Please mark them down, because people often make mistake like axillary in rectal and then rectal in axillary. That's not, yeah, we can't do that. Look for the signs and symptoms like yellow eyes, sclera, diarrhea. Why? A lot of diarrhea, constipation, cough, tremors, seizures, because in high fever a baby can experience tonic-clonic seizures. Shaking baby syndrome. Okay, so never shake the baby. Never let anybody shake the baby. And postpartum depression, mothers sometimes get aggressive, or they are like depressed and they shake the baby. If at any moment you feel like, please put the baby down, step out, have some break, call friends and family, call someone, and instead of getting frustrated, focus on why is the baby crying? What's the reason? Is he hungry? Maybe he's overeating. Maybe he has a wet diaper. Maybe he's a poopy diaper. Maybe he's in pain. Maybe he's sleepy. I mean, instead of we should try to find the reason for the baby, that why is the baby crying, and try to soothe the baby. And there are several ways. You can sing to the baby, touch the baby, rocking motion. Maybe he wants to burp. You see? So that's more important.
He's trying to communicate.
Yes.
Is the only way of communication is crying.
Crying, yes, very well said. Do you know about SIDS? That's
when the baby passes away in the sleep and crib.
Yes, it's scary. I know it's scary. So if you breastfeed the baby, there are less chances. Pacifiers while they're sleeping, save them. try nobody should smoke in front of or
Right, I
in
don't
the
smoke.
area. Yeah, that's
Nobody
great.
should smoke around the baby.
Yeah. Practice safe sleeping. No co-sleeping. Baby can sleep in the same room but in a separate bassinet or a crib. No soft mattresses, no water beds, no pillows, no sleeping on the chair, couch, sofa. And try to avoid overclothing. Make
Yes.
sure that the baby sleep in onesie
Right.
and the temperature is fine. Do not put your baby asleep on the belly.
Right, he has to sleep on the back.
On the back, yes. And no toys in the crib as well. Firm tight mattress, sleep on his back, sleep in the same room but not in the rest of the yard. We talked about it. Infection control, hand hygiene. Every visitor is coming, please make sure they are vaccinated. They can give some germs or pathogens to the baby, like if bottle feeding, sterilize the bottle because that can give him infection or stomachache. Discard leftover milk. Do not freeze it. Follow up with the vaccination. Follow up. You have a doctor visit tomorrow.
Yes.
The one day, yeah. So follow up with the doctor. That's very important. Airway clearance. So you know that breathing is the most important.
Yes.
Baby may have difficult breathing sometimes due to the mucus and fluid, and it can hinder while you're breastfeeding or breathing. Use a bulb syringe. Here we give you a bulb syringe. Try to pull out the fluid first from the mouth, then you use it in the ears, and use it only when it is necessary because it can cause nasal swelling. Newborn jaundice, vaginal birth or some baby get jaundice, yellow skin, eyes, yellow sclera, not peeing like normal, the pee color is not normal, call the pediatrician. This is something you should be checking on. Car seat safety. So we already checked him for the car seat safety. He passed the test. Now make sure that the seat base is well secured, and it's rear facing because he's until he's 2 years old.
Yes.
Yeah. And whenever the baby is sitting in the car, make sure the head is at least an inch below the top of the seat. No extra padding in the car seat. No bulky clothing under the harness, and chest clip is positioned at the armpit level. So that's a safe way because it's there. Yeah. So one last thing. Let's do the warning signs. Very important. If baby refuses to eat, unusual sleepiness. What's going on? It's like drowsy, sleeping again and again. Axillary temperature that is higher than 99 Fahrenheit. Rectal temperature that is higher than 100.4 Fahrenheit. Yellow skin or eyes. Constant crying that is unconsolable. That's not normal, right? We'll look for normals.
Right.
Change in stool patterns after first week, especially. Constipated, you'll see like pebble stool. The baby is struggling. Watery stool, diarrhea. Can dehydrate. Urate, reddish stain for in the diaper. Projectile vomiting. Frequent coughing. Blotchy rash. And the most importantly that you need to call 911 or you have to go to the ER is if the baby's lips are cyanotic, they are blue, tongue, mouth.
911.
Yes. Why? Because there is
no air,
no oxygen, no air. Very good, very good. Serious difficult breathing. Okay, and look for seizures and tremors because that is one of the manifestation of high fever. Yeah. So these are the very important things as a mother you should know. And do you have any extra questions? Because we have some more time.
What time can I take my baby home?
Sure. Be safe. And we are here. You should know that even if we are like, you are on, hours are closed, triage nurse is always there to help. You can call the triage nurse and she can provide you with all the information, or you should provide that what kind of problems are or what are the signs and symptoms going on, and they will help you with the baby. So we are here to help you, and
thank you.
You're very welcome. And if you have any questions, you can contact us.
Okay.
Thank you very much, and that will be the end. Now you're ready to go.
I have one quick question. When I'm ready to switch over to formula, does the doctor or who helps me make that decision?
Yeah, so whenever you feel like that you are you want to transit to the bottle feed, you can transit.
And they'll help me choose.
Yes.
Okay. Well, thank you.
Bye bye.